My name is Carmel Hauck. My student number is T00701793. I have a selection of my clinic mentors here today to watch my presentation. My topic that I chose of immunological importance is systemic lupus erythematosus. This is a picture of one of my vet's old tollers. Tollers are the #1 breed that are predisposed to SLE. So, what is systemic lupus erythematosus? It is a rare immune-mediated disease where an animal's immune system begins to attack their own tissues and internal organs. It's commonly called lupus, or SLE for short. The animal's immune system fights itself by forming antibodies that protect it against its own cells and tissues. So this results in inflammation and tissue damage across the body. Why is SLE of immunological importance? So, SLE is a disease that is referred to as a great imitator, as it has a lot of symptoms that mimic other diseases or disease processes. So it often gets misdiagnosed and it can be overlooked as the symptoms are very vague or very similar to other diseases. Lupus is a disease that exists in human medicine, but it is not zoonotic and there's no transfer between humans to animals. SLE is a completely different but similar disease to lupus. It is possible for felines to develop SLE, but it's very rare. So my presentation is on canines specifically, but it's a very low chance that felines can get SLE as well. It can develop at any breed, at any age. Some breeds are more predisposed, which leads scientists to believe that genetics play a big role in it. The average age of onset is 5 years, and male dogs are on average more at risk than female dogs to get SLE. So I have zebras here. If you're familiar with the term, in medical world, if you hear hoofbeats in the hallway, think horses, not zebras. This is a zebra disease. It is not thought about very often as an immediate diagnosis. So why is SLE important to me? This is Sage. She is a toller that belonged to one of my coworkers. She was diagnosed with SLE after a very long suffering with some polyarthritis and just random health decline. She was misdiagnosed for years, and then when she came to my practice, she met my vet who breeds tollers and was introduced to the disease, and the disease unfortunately took her life, but once it was diagnosed, we were able to kind of help her a little bit more. So that's where I learned about SLE, was with Sage. What is the cause of SLE? It's a mystery. There's no known cause for why the immune system starts to attack itself. Again, like I said, since specific breeds are predisposed, it's likely that genetics play a role, but it has not been discovered yet. You do also have physiologic and environmental factors that play a role too, but there's no cure, and once you have it, it needs lifelong treatment. These are some predisposed breeds. Brenda, you own 2 of them, unfortunately. So tollers are #1, but then we got Shelties, Collies, German Shepherds, Sheepdogs, Beagles, Setters, and Poodles. They are all predisposed for whatever reason it may be. What happens when a dog develops SLE? So every tissue in the body has antigens that are capable of triggering an immune response when they're stimulated. And then when they're stimulated, the body produces antibodies that are programmed to attack the foreign invaders. With SLE, the antibodies get confused and start to attack the animal's own tissues and organs as if they were foreign invaders. So the symptoms will depend on where the body in the immune system it's attacking, but typically we see some general systemic symptoms, musculoskeletal symptoms, and dermatological symptoms, or a combo of a bit of all of the above. So these are some of the symptoms. Lupus causes abnormalities of the skin, heart, lungs, kidneys, joints, nervous systems, and blood. They can be acute or chronic symptoms, and they will usually come and go over time in flares. As it progresses, it normally will worsen. You'll feel worse symptoms and more concerning symptoms. And then again, a combination of body systems are involved, so we usually see some random generic systemic symptoms too. These are some of the symptoms. So lethargy, fever, decreased appetite, low counts, enlarged lymph nodes, spleens, and livers, and some seizures and tremors are seen as well. So these are some enlarged popliteal lymph nodes. These are the musculoskeletal symptoms. So 1/2 of all affected dogs have polyarthritis, so arthritis in more than one joint. They'll have lameness that shifts around from limb to limb, muscle pain, and muscle atrophy. One of the common signs is the facial muscle atrophy. So this is a Vishla that had kind of a before and after of what they looked like through their SLE diagnosis. Dermatological symptoms. So 1/3 of affected dogs will have some sort of dermatological symptoms. So that includes skin changes, rashes, sores, or erythema, alopecia, pigment loss, mouth ulcers, and symmetrical dermatitis, which is also called the butterfly lesion, which you can kind of see why it's called that from this picture here. It's always kind of the raccoon eyes around the face. This is a study I found in 1992. It was done in the United States on 75 sourced dogs that had SLE diagnosis or 4 or more SLE symptoms. It was not a very detailed study. It essentially just told me the common signs of SLE. So 91% of the 75 dogs had polyarthritis, 65% of them had renal deficiencies, 60% had cutaneous mucus disorders, and 13% of them had hemolytic anemia. The second study I found was in 2001, done in the United Kingdom. This one had 25 patients, so 11 Shelties, 7 rough collies, and 7 purebred or mixed border collies. 73% of those, their symptoms began in the summertime, 92% of them had polyarthritis, and 28% of them had lesions or dermatological symptoms. So both cases had very high counts of polyarthritis, which is why a lot of them just get blown over as your dog's arthritic, blah, 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 and they don't do any additional testing until more symptoms show up. So a flare is when the symptoms will come and go with fluctuating severity. So flares and their symptoms will range in how often they are showing up and how mild to serious the symptoms are as well. So the severity and frequency of the flares depends on the current treatment that the dog is on, the environmental factors as if it's summer or winter, and then again how the other organs are functioning too at that point. So after a flare, they still have the disease, it just goes quiet, and then that's called remission. So dogs can be in remission versus a flare for any number of time. It's completely random dog to dog. So this is a slide about when SLE gets more serious. It's kind of a hefty slide, but essentially as the disease progresses, we start to see the worser symptoms. So you see kidney problems and anemia mostly. You would have like PUPD, nausea, vomiting, loss of appetite, and muscle wasting. These are the ones that are kind of showing up later in the diagnosis. So 15 to 20% of dogs with SLE will get IMHA, or immune-mediated hemolytic anemia, which is a disease that attacks its own red blood cells. So we get very low red counts, and we have a risk of blood clots. Since the destroyed red blood cells are recycled through the spleen, when it gets those higher numbers, it is very often overwhelmed and it swells. And then the liver too is overwhelmed because the increased waste product, bilirubin, takes effect too. So you have kidneys and livers that are both being overworked and not able to distribute oxygen. So at this point, it's critical their body is not working how it should. And then I have a bit about how SLE is diagnosed. So a diagnosis should always start with a full physical exam and a full thorough health history. Since SLE can cover a wide array of systems, it takes a lot of trial and error to get to a diagnosis. It's one of those ones you have to rule out what it isn't before you can rule out what it is. So diagnosis relies on a lot of tests, a lot of diagnostics, and the patient's symptoms we have to take into effect too. So these are some of the testing that we would use. So radiographs to kind of analyze those musculoskeletal symptoms and internal organ function, ultrasound for organ function and size, blood analysis can let us check for antibodies that are attacking the system and then monitor the liver, kidney, and internal organ function. Urinalysis, same thing, protein loss and kidney function. And then for those lesions or areas of irritation, we can do biopsy or cytology to look for abnormalities. Joint taps are included in the testing as well. And then the last form of testing is anti-nuclear antibody testing. This is not 100% a diagnosis. Anti-nuclear antibodies are autoantibodies that work against nuclear components. So they're present in many different cases, many different scenarios and diseases. So the presence of them alone is not enough to diagnose it, but with the other testing and appropriate history and symptoms, a positive ANA titer is likely indicative of SLE. 95% of dogs that have SLE will test positive for anti-nuclear antibodies. This test uses serum and then rat liver cells. And essentially, if there are anti-nuclear antibodies in the serum, they bind to the nucleus or the nuclei of the rat liver cells where they're detected with fluorescent microscopy. So then they'll do the titer on that with serial dilution, It's a very expensive test. It's very hard to source. I only found one place in Canada that does it. And again, it just is kind of a vague probable diagnosis. So it exists, but it is not a diagnosis. It just kind of is an additional on top. This is the titer breakdown. So if you have a negative titer, it's likely not SLE, but it's not off the possibility that it's a different immune-mediated disease. And then if you have a low or equal to 1.4, it is a low positive titer. It is not specific though, because you'll see that in geriatric patients or patients with other inflammatory or infectious processes too. And then a higher or equal to 1.8 is a high titer. And if it's accompanied with the right symptoms and the right the diagnostic testing that we're seeing, then it's most likely indicative of it. But again, you can see it with some other diseases in normal dogs, so it's not 100% a diagnosis. How can we treat it? So there's no cure for SLE. The goal of treatment is to minimize pain and symptoms. Typically, patients can be treated as outpatients at home with regular check-ins with their vet. Treatment depends on which body systems are currently affected. There's plenty of medications around for decreasing inflammation and autoimmune activity. Typically, we use a corticosteroid like prednisone and immunosuppressants together. And then rest and exercise is restricted to keep them from hurting themselves. And these are some of the common medications prescribed. So like I said, corticosteroids, typically prednisone or prednisolone. It has lots of side effects, and it typically requires some pretty strict dose tapering with the flares and the remission. Immunosuppressants are a family of drugs that help to hold in the immune system from attacking its own tissue. We again see lots of side effects, and they are risky to use as now the immune system is susceptible to other diseases. So typically cyclosporine and cyclophosphamide are used. And then alpha-amintix, we have a new study I found in Korea that's using levamisole, which is a dewormer, but it has immunomodulatory effects. So there's still a ton of research on it, but it had an effect on T cells in the body, and that dog was able to be tapered off of steroids and cyclosporine, and it was on it for 2 months and remained in remission for 2 years before it was deemed a success. So that is still very much in the works, but interesting kind of a process. So what is their prognosis / life expectancy? Dogs that are diagnosed with SLE have a very guarded prognosis. It's a nasty disease, and it can be super difficult to treat as it's progressive and very unpredictable. Diagnosed dogs require lifelong treatment to decrease the immune response, and both the disease and the treatment of the disease is worrisome. The severity of the disease and the number of organs affected can lessen or worsen the effects of the disease as well. And the complications are endless. You have very high risk of like fatal organ failure with this disease. It also requires quite the lifestyle change. It is going to be expensive and difficult to treat. You're going to need lots of different meds and treatments. Mobility is going to be decreased, and or their exercise will have to be restricted. Again, if the skin is infected, they're going to be sensitive to UV rays, so you'll have to get minimal exposure or change up when their walks, etc. are happening. And then if the kidneys are affected, they'll need to be on a high quality kidney diet as well. Pop quiz. So this is where I include you a little bit. I have a prize for whoever can guess how many times I said SLE during this presentation. And I will get you a prize if you get the right answer. So I'll get those later, but that was my presentation. Any questions?
No, that was very thorough.
Great. Thank you so much.